This segment is sponsored by Oklahoma Proton Center. While we are raising awareness about breast cancer, throat cancer is also impacting many lives. Joining us now is Dr. Chang with the Oklahoma Proton Center. Welcome to the show.
Well, thank you for having me.
Yeah,
I
let's talk about throat cancer. How common is it and how do you detect it?
Well, so throat cancer actually is not as common, obviously, as breast cancer or lung cancer or prostate cancer, but it affects 50,000 Americans every year.
Wow.
And it's associated with at least 10,000 deaths related to cancer each year as well, so it's significant.
Yeah.
Now, it usually presents itself really from patient detection. They usually notice something wrong with their voice, so some hoarseness that can happen. Sometimes some trouble with swallowing, either related to pain or feelings of blockage. Otherwise, they can also notice a lump in their neck. They could feel that or feel something in their mouth or throat.
What are some causes of this?
So it's really in two categories. One, we kind of call the vices, right? So you have smoking, which is known cause. Chewing tobacco can cause it. Obviously, excess in alcohol use. But the other category that we're just kind of coming to light is a viral infection.
Oh.
So human papillomavirus has been linked to many different cancers. And this is a virus that actually goes in the body, finds vulnerable cells, and then turns them into cancer cells, and then they develop into cancer and tumors.
So what are some preventative measures when it comes to preventing this?
Yeah, so obviously the easy thing to say about the vices is avoid doing them, right? So it's easier said than done, but obviously eliminating smoking, stop chewing tobacco, moderating your use of alcohol. But for the virus, we really have to get better about that, both as a medical profession and also as the population at whole. There are vaccines now that have been in place for over 10 years. We just haven't been utilizing them as much for human papillomavirus. But this HPV vaccine has been proven to be safe and effective, and if we can start vaccinating children and young adults, we hopefully can eliminate this virus and obviously decrease the incidence of these cancers.
Let's kind of turn towards treatment options. What are some and how do they work?
Yeah, so treatment of head and neck cancer is very complicated because it affects so many organs at such critical areas of the body. So we usually have a team of specialists that know surgical techniques, that know the systemic treatments such as targeted therapy and chemotherapy, and then obviously radiation. And with radiation, the pinnacle of what we can do with radiation really is proton therapy, where we can actually deliver the treatment to the target area and eliminate or minimize the collateral radiation exposure, which then limits the amount of side effects people are exposed to.
And let's talk about the quality of life after some of these treatments.
Yeah, that's really the main goal of all this. We've gotten so much better at treating these patients that our cure rates are upwards of 70 up to 90% for some cases and some types of tumors. Because of that, I was imparted a motto from one of my mentors, and he said, cure is not enough. What he meant by that is just curing the patient is not enough. You really have to focus on quality of life, because if your treatment is more toxic than the tumor itself, then have you really helped the patient?
Yeah.
Nothing really resonates as well as that, as a story that I have of a patient I treated 5 years ago. He was actually a professional lead singer of a band that actually toured nationally. And he was told when he had head and neck cancer, very advanced head and neck cancer, by the leading cancer institutions that he needed surgery and then radiation and chemotherapy together with standard radiation. He was told that he would never sing professionally again.
Wow.
That devastated him. He actually did his own research, found proton therapy, and I'm happy to say 5 years later, after I treated him with protons and chemotherapy, he is cancer-free, never needed a feeding tube, and he just finished his last tour for 2019.
Oh, wow.
He's set to tour again in the spring of next year.
That's
incredible.
amazing.
Yeah, and that's the story that really is the norm now, as opposed to the exception.
We all
And that's-
really do amazing work, and we really appreciate it. So thank you so much for coming in, and
My pleasure.
cheers to that story. That's
Yeah.
so encouraging. I know for a lot of
Incredible.
folks there at home, we appreciate it.
Thank you.
Oklahoma Proton Center is located at 901 West Memorial Road in Oklahoma City. You can find them online at okcproton.com or give them a call at 405-773-6700.